What are the underlying causes of chronic urticaria?
Now this is a difficult question, but it's one of the questions that makes urticaria as a disease so interesting. We have to say that there's a big difference between chronic spontaneous urticaria and chronic inducible urticarias. In chronic spontaneous urticaria, we know some of the underlying causes, and they include infections, chronic bacterial infections, for example. They include autoreactivity or autoimmunity, where the immune system of the body reacts with something else in the body to cause urticaria. And intolerance to food. Certain food items or additives can also be a cause of chronic spontaneous urticaria. In contrast, in chronic inducible urticaria, let's say cold urticaria, where contact with cold makes the swellings come, we do not know the underlying causes. We know that it needs to be cold for wheals to occur, but the underlying causes are unknown. So yes, in chronic spontaneous urticaria, it can make sense to look for the underlying causes because some of them can be taken away, and that's a cure, but not in chronic inducible urticaria.
In chronic spontaneous urticaria, why it is so difficult to find these underlying causes?
This is difficult because you can't tell from looking at the wheals or looking at the angioedema what the underlying cause is. So you have to investigate and do tests to guide the investigation to the right cause. Because there are so many causes and because our tests are not yet very good, we need to do a lot of tests. We need to do an elimination diet, we need to do provocation tests. This takes time, and this is why this is not necessary or useful in all patients. It's useful in some patients, but not required to happen in all patients.
Tell me a little bit more about intolerance urticaria and its diagnosis.
Intolerance urticaria. What do we mean when we say intolerance urticaria? Some patients with chronic spontaneous urticaria are intolerant to food components. And these food components can be additives such as preservatives or colorants. They can also be components of natural foods, fruits and vegetables. They can be histamine, for example, rare, but yes, can be. So if you're intolerant, not allergic, but intolerant to certain food items or drugs, you can develop chronic spontaneous urticaria.